All right. Thank you for joining us today, everyone. We've got a large number of people from across the country visiting for this 30-minute webinar on new 2020 Vaping Prevention Plus Wellness programs. This session will last about 30 minutes, after which I will, and by the way, I'm recording this, so I'll send everyone who's registered a link to this recorded session. I'll send you a PDF of all the PowerPoint slides, and I'll send you a certificate for half an hour CEU time. All you have to do is type in your name and print out a copy for your records. So those are the things I'll be sending you. And again, we'll have 30 minutes together. We'll stop at about 20 minutes into the presentation, and then we'll open it up for Q&A. Number one, I want to know any questions you might have about the new Vaping Prevention Plus Wellness program, anything that wasn't clear, anything you want to know more about. Secondly, I'm going to be asking about what you liked best about these programs, what you'd like to keep, what you thought were the highlights of the programs, the advantage of the programs. And then thirdly, what did you like least about what you're seeing here with these PPW programs? What would you like to see changed? So that's what we'll be, I'll be asking you after today's presentation, but let's take a look at today's actual objectives for the webinar. Excuse me. So first of all, I will be exploring the improved contents of the single session evidence-informed Vaping Prevention Plus Wellness, or PPW program. We have versions for high school, middle school, and elementary school. And this is a single session screening and brief intervention. It's very, very motivational. It's designed to initiate behavior change in young people, to get them to avoid or stop using, in some cases, e-cigarettes, and as well as to increase protective wellness behaviors, including physical activity, healthy nutrition, sleep, in particular, and even stress control. So this is evidence-informed, this program, Vaping PPW, because it is founded on the evidence-based Sport Prevention Plus Wellness program. And we have not yet evaluated it like we have Sport and InShape PPW. And so that's why we call it evidence-informed. That said, it is an evidence-based practice in that it is screening and brief intervention. Keep that in mind. Second objective for today is to review the updated PowerPoint slides that permit more interactive presentation of both face-to-face and online. So we've developed all of our Prevention Plus Wellness programs to be provided face-to-face as well as online to address the current situation, the pandemic. And thirdly, we'll talk about, at least mention, the new reproducible materials that are found in your program download. So that's what we'll be showing you today. Just a brief overview of the Vaping Prevention Plus Wellness program, so you understand what it is for those of you that haven't used any of our Prevention Plus Wellness programs. By the way, if you want to learn more about these programs, go to our website, preventionpluswellness.com, and that's where you'll find out a lot, as much as you want to know, I would suspect, about all Prevention Plus Wellness programs, training. And the good news is, under the heading of tools, TOOLS, we have a bunch of free resources. So if you're a prevention health specialist, a parent, even a youth, there's some great resources there for you, as well as our weekly news items or blogs. So what is the Vaping Prevention Plus Wellness program? It is evidence-informed. As I said, it's based on or founded on the evidence-based Sport Prevention Plus Wellness program. And it is also an evidence-based practice according to SAMHSA, the Substance Abuse Mental Health Services Administration. It's a single session screening and brief intervention, so very, very practical. It can be implemented to all youth in a school, in a community, even throughout a state. Very efficient. and can reach youth that you wouldn't be able to reach with multi-lesson prevention and health programs. It's a screening and brief intervention, as I said, which is evidence-based practice. 3 steps for implementation: screen youth for their current health habits, including use of e-cigarettes, but also physical activity, nutrition, sleep, breakfast. Secondly, provide feedback about those behaviors designed to, and focusing on positive image, designed to cue desired future images of youth, of themselves in the future, being more fit and active and healthy, engage in those wellness behaviors, and showing how e-cigarette use harms those behaviors and images and benefits. Thirdly, walking youth through multiple behavior goal setting, not just to avoid vaping, but to increase protective wellness behaviors. 3 steps: screening, feedback, and goal setting. We have high school, middle school, and a brand new elementary school version of the Vaping Prevention Plus Wellness program. So you can reach all developmental ages, from children to young adolescents to older adolescents. The Vaping PPW program, as in most of Prevention Plus Wellness programs, come with a manual with the scripts to provide them, again, face-to-face or online, as well as a digital download, including your PowerPoint slides and all reproducible materials. So you can provide this program to countless youth, dozens, hundreds, thousands. You just have that one-time purchase of your program materials and you're off and running, nothing else to purchase after that. So it's a great deal. The more you implement it, the less expensive it becomes per student. So you could end up really having it be just pennies per student. We have a recommended 2-hour live online program implementer training. That's very important to learn how to best use your Vaping PPW program. And we also have a 2-hour live train the trainer. Typically what happens is, if you're interested in train the trainer, you first become trained as an implementer. You implement your Vaping PPW program once, and then you're eligible for your 2-hour live online train the trainer, where you can train other implementers to provide the Vaping PPW program in your organization, your region, your state. And we also have a youth leadership training option, where we can train youth to implement the Vaping Prevention Plus Wellness program to their same age or younger age peers. Great experience for youth, great opportunity for them to learn about evidence-informed programs, the intersection of prevention with wellness, and a very, very hands-on, practical, and powerful leadership and modeling experience for youth. And that could be youth, general youth, high-risk youth, high-achieving youth. All of them can be targeted for this youth leadership training, and to provide the single session Vaping Prevention Plus Wellness program to their peers. There's a view or a shot of the cover of the high school version of the Vaping PPW program. This is e-cigarette use prevention program promoting wellness for high school adolescents. There's the middle school version. So high school age, 14 to 18, middle school 10 to 14. And then elementary, I'd say about 8 or so to 10 years of age, depending on their reading level. So here's the table of contents in each of these 3 programs, whether it's high school, middle school, or elementary school. There's an introduction to the program, which has great information. There's a section 2, which provides step-by-step directions for implementation. Section 3 includes a copy of the screening survey and the goal plan. Remember, screening, feedback, goal setting, those are the 3 steps in implementing Vaping Prevention Plus Wellness, as well as all Prevention Plus Wellness programs, because it's a screening and brief intervention. So you have a copy of the screening and goal plan in section 3, but you also have those in your digital download in a PDF. So you can make as many copies as you need to provide the Vaping PPW program to as many youth as you want. Section 4 has an individual youth program script. This is for high school, middle school versions only. This is where you provide your program to youth one-on-one. This could be all youth. It could be high-risk youth. It could be youth caught for vaping. Whatever the case might be, you could implement this in a very powerful way, and it's most tailored in the one-on-one script, because you're going to provide feedback that's customized to the youth regarding how they answered on their screening survey items, on their health screening survey items. I'll show you this in a minute. Section 5 is the group script, so you can provide the Vaping PPW program to a group of youth. And remember, you can do this face-to-face or online. In fact, as you can see, Section 6 has remote online protocols. So we give you step-by-step protocols for implementing online the Vaping PPW program to youth one-on-one or in a group or by video or by telephone. And lastly, there's built-in evaluation tools. Includes a pre-post test, a scannable pre-post test, which you can scan on any printer scanner and send to us for free analysis. Or we also include an online pre-post test. We now include an online in addition to the regular program goal set, so that you could actually send youth a link and have them complete their goal setting online. So we've really adapted things so that you can provide your program face-to-face or online using hard copies of materials or going and using online tools. So let me show you some of the slides that you would present of the Vaping Prevention Plus Wellness program, the high school adolescent version. This is the high school version. So you follow your protocol to implement your program. Again, this could be in person or online. And you follow this, you follow your slides. Your slides really walk you through the program. So for example, this is the introductory slide. And then this is the second slide, which tells everybody who's participating at this point, face-to-face or online, to complete the health and fitness screen. Then the health and fitness screening questions are presented in slides, just like these here. This is the high school version. Notice this is an adaptation of the Sport Prevention Plus Wellness program. The first question is, what sports and physical activities did you play in the last year? There's a long list of them. And that continues on to the next slide, and even an open-ended item to include any others, trying to give youth as much support and reinforcement for any kind of physical activity they're getting. That's a very powerful, positive norm and message for youth. The second question in the high school version and in the middle school version, elementary school version, a little bit different. Elementary school version in particular, easier questions, easier to answer. But the second question in the high school version is about regular physical activity, 30 minutes or more, 4 or 5 times a week. There's a question 3 about social influence for physical activity. Question 4 about healthy breakfast and nutrition. Question 5 about sleeping 8 or more hours. And question 6 about ever using any electronic or e-cigarettes. So that's it. Very, very brief screening, but notice it doesn't just address e-cigarette use, it addresses the protective wellness behavior. So that's the first part of your implementation. You have young people self-assess their health habits, and then you provide feedback, and that you do that again following your script in your manual. That's your Vaping Prevention Plus Wellness Program manual. And the slides restate those screening questions. So this is the first screening question: what sports, physical activities did you play last year? Then you provide feedback. The slides provide feedback designed to trigger positive images of young people engaged in that wellness behavior. This one, sports, physical activities last year. Notice image terms like fit and strong, which are highly, highly evocative. And they bring up, they trigger unconsciously images of young people, which are very motivational, increases motivation for desirable change in the healthy habits. And then you link how vaping e-cigarettes interferes with that wellness behavior, or in this case, interferes with being physically active or engaging in physical activity. Then the second screening question was about regular physical activity. 30 minutes 4 or 5 times a week, for example, riding a bike, running, walking, and so forth. Again, feedback designed to trigger positive images showing benefits of regular physical activity. And we've built in now, especially useful for group settings and online discussion questions, to pause, to get young people to participate. You really want, when you're presenting this online, you really want to have that participation. You want the young people to stop and think about their own health habits. So you ask the question, what types of sports or the physical activities would you like to try or do more of? This is where you can get some feedback. It could be feedback verbally, or it could be feedback by live chat, depending on what platform you're using. If you're by phone, obviously it would be verbal and so forth. So we discuss all of this both in the, and it's presented in the protocols for online presentation, but then we discuss this in our program implementer training, our live 2-hour online program implementer training. We cover all this and tailor it to your organizations and your personal needs for presentation. So vaping can raise blood pressure, reduce blood flow, harming physical performance. So again, linking how vaping is counterproductive. And then there are questions, again, all of the questions are restated, and then there's feedback about healthy breakfast and nutrition, getting 8 or more hours of sleep, ever using an electronic cigarette. And here there's more content under the heading of ever using an electronic cigarette. There's quite a bit more content addressing a number of different risk factors. So we do want to restate that an active life and vaping don't mix, linking those behaviors, and avoiding cigarette use, and making sure that we state that is critical. Having them think about problems people their age would have with e-cigarette use, and by not vaping, they don't have to worry about harm such as to the brain, learning, lungs, physical fitness, etc. But then we're also discussing things like a common myths, such as the largest, perhaps the most prevalent myth is that vaping e-cigarettes is healthier than using tobacco cigarette, and so on. So there's a number, a number of other risk factors, social norms that most young people do not use e-cigarettes, etc. These are all addressed in your script, in your protocol, in your manual, as well as the slides. Lastly, then, toward the end of the presentation, there's recommendations for increasing wellness. It doesn't just include number 4, avoiding e-cigarettes, but notice it also expands to tobacco, alcohol, other substance use, but also look at items number 1, 2, and 3, which are a review of your previous content to them, and that you want them to consider getting plenty of sleep, eating breakfast regularly, eating plenty of fruits and vegetables, avoiding junk food, getting lots of physical activity of different kinds. And those are incredible recommendations that will prevent chronic disease risk, but also help combat substance use. And then the last part of your program and slide, that third step, is a goal contract, goal plan and contract. And this can be done using your slides, or you can pull up your PDF of your goal plan. And then we do have a link to an online goal plan. And we can customize that link and send your organization a customized link so that when your youth complete that goal plan, you'll just have that data separate from anybody else's data. So you'll be able to review how your youth are completing the goal plan, which is good for monitoring program implementation and quality. So program and training costs, for those of you that be interested, Vaping Prevention Plus Wellness Program Manual and a digital download is a one-time purchase of $4.99. So you have your manual, you have your digital download, you copy your download to your device, and you're off and running, and you're ready to implement this to, again, as many youth as you want. Nothing else to purchase beyond that, no other materials. You make copies of whatever you need from your download. The online program implementer training, which is live 2 hours, but we also have a couple of also extra recorded 1 hour sessions on core knowledge and on online implementation. That's $199 per implementer. Online training of trainer for those of you interested in training others, providers in the Vaping Prevention Plus Wellness program, that's $349. Then we have the youth leadership training. If you want to have youth trained to implement Vaping PPW to other peers, same age or younger age, it's $499 for up to 50 participants. This could be mostly youth and maybe some adult mentors. And then the youth leader script in a booklet form is $19 per youth. So those are some options for the program materials and training. And so that you can implement this to high school, middle school, elementary school, train others to implement, other professionals in your area, and even have youth trained. And you could also become trained as a trainer to train youth to implement it to their peers. So lots of options and opportunities. And now, of course, we're branching off and thinking about how we can train our youth to also provide the this program to their peers online, not just in person, but online. So I am going to stop at this point. And actually, let me see, I'm going to pull up the Q&A. And so here's the Q&A. I'm not sure I've ever used this Q&A before. I'm going to open the Q&A, no open questions. I'm not going to do that. I'm just going to say, let's just go to the live chat. I'm going to shut down the slides at this point. So find the live chat, you know where it is, click on it. And so the first question at hand, we've got time now for some discussion. So the first question is, do you have any questions or comments about the Vaping Prevention Plus Wellness program? Was there anything that you were clear about? Anything you want to have clarified? Anything you want to ask or any comments you want to make? Just generally. And then after that, we're going to talk about the pros and cons of the program as you see it. So let's see if you have any questions. I'm going to go back to the Q&A. And I see everybody could see me, hear me. Let me just give you another minute or two. And if you have a question, you have a comment about the Vaping Prevention Plus Wellness program, just click on that live chat, type it in, a couple of words, a sentence, whatever, anything very brief. So I could see here, I came on a few minutes late. Is this program considered evidence-based? So that's a good question. We did discuss that. It's considered yes and no. It's considered we call it an evidence-informed program because it is founded on the evidence-based Sport Prevention Plus Wellness program, but it has not gone through the rigorous research process of evaluating its outcomes. However, it is considered an evidence-based practice in that it is a screening and brief intervention. So you can call it whatever you want. You can call it an evidence-informed program. You can call it an evidence-based practice because it's screening and brief intervention. It's both, or it's somewhere in between, or it's one or the other. But I think you get the idea of it. The good news is it does have, it is founded in evidence-based practices, is founded on an evidence-based model, has a solid conceptual basis, the behavior image model. And so you can feel confident that it has real potential to have an impact. Now, having said that, even with the most well-tested evidence-based programs, we always recommend evaluating outcomes because you're implementing your evidence-based program in a different setting with different implementers, with different skills and experiences, with different populations. And so that's why we build in pre-post surveys, goal plans, instructors surveys, fidelity checklist, we have these tools so that you can track the program implementation quality and potential immediate pre-post outcomes. So, and we work with you to help you track and monitor and promote your program and improve it over time. So big believers in that, regardless of the evidential support for the program. So great question. Any other questions? Okay, so now let me ask you this, 2 more questions. What do you see as the advantages, or what did you like best about the Vaping Prevention Plus Wellness program? Is it the cost? Is it the one-time purchase? Is it the single session? Is it that there is some support for its effectiveness? Is it that it links with other, what is it? That's, I'm going to ask you that first. What did you like best? I'd love to hear that feedback. And then afterwards, I'm going to ask you, what didn't you like about it, so that we could see if we might make some improvement. But first, what did you like about what you heard about the Vaping PPW program? Let's say, should there be a wait period between or back to back? Okay, wait a second here. How repetitive would it be to do regular sport and vaping components with the same students, the same year? Should there be a wait period? So that's a great question. So so just to give you some context for those of you that aren't aware, the Sport Prevention Plus Wellness program is the original single session evidence-based program. The main difference is that it focuses largely on alcohol use, and so it does not address directly vaping, e-cigarette use. That's why we developed the Vaping Prevention Plus Wellness program. That's why we developed the Marijuana Prevention Plus Wellness program, to develop marijuana in relation to the other health behaviors. That's why we developed the Opioid Prevention Plus Wellness program. So these other evidence-informed programs, vaping, marijuana, opioid prevention plus wellness, as well as our faith-based in God's image, all of those are spin-offs, modifications of the original sport. Now, can you implement sport and then vaping and then marijuana, opioids? I think you can. I think it's fine for youth. And in fact, I think it's desirable to have youth reassess their health habits. And that could be done as early as on a weekly basis. I think it's great for them to see how vaping interferes with healthy behaviors, nutrition, breakfast, sleep, physical activity, sports, as well as alcohol, as well as marijuana. I think you can give them back to back to back. It's great for youth to set goals in relation to those wellness behaviors, as well as avoiding the risk behaviors. So I think there's no rule of thumb. It's try it yourself, see what the feedback is from your youth. But if you are only using one of our programs, based on the research, we recommend you re-implement these programs at least on an annual basis, if not every 6 months or so. So strong effects were found from sport for youth, in shape for young adults at 3 months post-intervention, some effects even a year later, but some weakening of effects over time. So do re-implement it, give youth an opportunity. Here's how we think of it. We think of it as an inoculation, a vaccine. A lot of talk about vaccines. This is a vaccine against common youth health risks, not just alcohol, vaping, marijuana, opioids, but also physical inactivity, not eating enough breakfast and poor nutrition, not getting adequate sleep, not controlling stress. All those things are addressed to a certain extent in all of these programs. And youth need a chance to reassess their health, get motivated by having that positive feedback, and setting goals to move themselves forward and increase self-regulation skills to set and monitor and achieve positive and holistic wellness lifestyle. So great question and long answer. Hope I answered. If not, let me know. The positive messaging showing active kids and what they can do versus using a negative spin. Thank you. So that is a plus. Research shows that Positive images are more effective than negative images, even though most public health and prevention programs, if they use imaging, they'll use negative. So much more positive is more effective. It loses less people in the communication process. You don't turn off any young people. The older the youth become, older adolescents in particular, have heard risk messages. They need to have something different. In particular, positive messaging is very powerful, and it's more of a holistic approach rather than just focusing on avoiding a substance. So those are, and then you're addressing the real needs of youth, not just avoiding substance use, but all these other needs, these chronic disease risks of physical inactivity, sedentary life, living, online viewing is increasing. Not getting, not eating any fruits and vegetables, not eating regular healthy breakfast, not getting adequate sleep, not controlling stress. All these things are real, and they impinge on the overall health and have an impact on the initiation and sustaining of substance use. So thank you for that. That's a positive. Any other positive? I'll give you one more chance to say. If you don't have any more positives, then say, what didn't you like? What did you like about the Vaping PPW program? Let me know. Now's the time for us to get your feedback. What would you like us to change? Is there something you didn't like? Pricing, single lesson, anything, whatever you've got, send it to me, and be specific. What do you want specifically? So if you're not happy with the pricing, what pricing would you be happy with? If you don't like a single session, how many sessions do you want? Whatever you can send me now, let me know. We can learn from you, and we could perhaps make some changes for you in the future. So let's see what we've got here. So it looks very implementable and in an online format. I also like that it focuses on topic areas that schools will care about. Vaping, marijuana, opioids, and those messages are front and center. Thank you for that feedback. I agree with you completely. Not only that, schools are also very much concerned, as well as families and communities and other organizations are also very concerned about sedentary living and obesity and sleep and stress. And so all these things are addressed within your Sport Prevention Plus Wellness, Vaping Prevention Plus Wellness, Opioid Prevention Plus Wellness program. Check it out, preventionpluswellness.com. Remember, we've got a bunch of free resources under the tools heading. So a lot of free content that you can use regardless of whether you use Prevention Plus Wellness, but you'll learn more of the model and why we're so passionate about, I really hate that term, so overused, but really focused on promoting overall health of youth, which is so desperately needed, even more so perhaps during the pandemic with kids being at home. What do you want to have changed? Let me know. I'd like to see a bundle when we do all components at a cost saving. So, well, we just posted something similar to that. If a large volume purchase, we do give a considerable cost break, 50% to 75%, but we don't have a bundle per se. So I like that idea. Let me think about that and see how we could set something up for you. If you have some concrete examples of that, let me know. But there's no reason why we cannot set up a bundle so we could encourage providers like yourselves to, maybe you're interested in providing sport, but you also want to explore vaping and marijuana prevention plus wellness, for example. So if we provide a bundle at a reduced cost, maybe that'll encourage you to do that. And we love that because we're all about trying to get as many of our programs into the hands of prevention and health providers and families as possible, and so that they get to the youth and have that impact that they can have on preventing substance use and promoting wellness habits. So that is an excellent idea. I'm going to write that down and give that some thought. Any other things you didn't like? Any other suggestions for change or improvement. It would be good if we purchased several. I gotta, let's see, a bundle. And then that would be good if we purchased several, but get a cost cut. Yes, I'll look into that. I'll give that some thought. And I will definitely offer something because that's a great, great idea. And thank you for that. Any other comments? Anything else you have suggestions for? Anything you didn't like about the Prevention Plus Wellness program? Something you changed? Last chance. I know we're running a little bit late, a few minutes afterwards, but just give you a couple more minutes. And remember, I'll be sending everyone who's registered for this session a link to this recorded session. I will send you a PDF of the slides. I'll put together even some kind of a bundle and send you a link to that because you've asked for that. So, and then a certificate for half an hour, I should say, 0.5 CEUs. So let's see if there's any other questions. Nothing else I see. So God bless you guys for all you do. Keep up the good work. Take care of yourselves, take care of your health, take care of the kids, keep interacting with them online. I think if anything, the content and the contact is essential. Keep in contact with your youth. We just posted a free Prevention Plus Wellness Youth 7-day challenge, goal challenge, free, and it's a great tool to get youth to set goals on a weekly basis. It's a part of every one of our Prevention Plus Wellness programs. This is a free tool we just posted. Check it out under our tools section on preventionpluswellness.com. And whatever you can do to promote and maintain and support healthy lifestyle goals and the behaviors of young people, very, very important. So thank you for what you do. Have a great day. Thanks for joining us, and do sign up on our website. Put your email in so that you can get regular emails from us about our free webinars and other materials. Thank you for joining us, everybody. Have a great day, everyone.